Well, we know there are lots of people who can't work from home and whose jobs potentially put them in direct contact with the virus. Paramedics, for example. As Mike Armstrong explains, this pandemic makes their job more complex and dangerous than ever before.
One of the worst outbreaks of COVID-19 in the country is this retirement home east of Montreal. There have been 4 deaths in this one location. It may also be one of the reasons the local ambulance service is down 17 paramedics. The director of operations says 2 of his paramedics have tested positive, 5 have symptoms and are waiting for tests, and 10 are in self-isolation as a precaution. Between all the extra cleaning and the overtime, the service has been stretched to its limits.
The
director says right now they can make do, but it's hard and they can't keep losing people. COVID-19 is complicating work for ambulance services right across the country. 2 paramedics in Toronto have tested positive and another in Waterloo, Ontario. It's not an easy job in normal times. Right now, it's even tougher.
There's a 6-foot or 2-meter safety distance.
Montreal paramedics now start every call with an evaluation. They ask the patient whether they've traveled recently. That determines whether they have to wear the full protective gear. But one of the problems paramedics are finding is people aren't always telling the truth.
If you are sick or you think you're sick, please tell us. That's number one.
Quebec's health minister appealed for honesty Monday. It's a matter of life or death, he said, and this isn't the time for lying. Well, in one of the calls to the retirement home, paramedics were in contact with a person who said they hadn't traveled. They later admitted they had, but said they didn't have any symptoms. They did. Mike Armstrong, Global News, Joliette, Quebec.
Community spread is what public health experts fear the most, and it's happening in Canada now. The virus is spreading from person to person in our communities. The thing is, it can't infect people it can't reach, and that's why keeping physically distant from people matters so much right now. Eric Sorensen explains.
Even when we gather, we're keeping apart. The behavioral shift in society has been astounding. With exceptions, an entire population has begun to maintain distance. The urgency made clear by the spike of almost 800 COVID-19 cases reported in Quebec the last 2 days.
I know we're going through difficult times. I know it's stressful.
The Premier telling Quebecers it will be temporary, but only if Canadians carry through with physical distancing. 90% of cases are now linked to community transmission, not international travel. And it's harder to track community transmission.
We've now shut down conferences and mass gatherings, and people are reducing any gatherings of over 50, but in fact going even more stringent than that. We're saying stay home and maintaining a 2-meter distance from others.
It'll require a long period of community-minded separation. Here's the trend in Canada. 1 month ago, there were 11 confirmed cases. We passed 100 confirmed cases on March 11th. We surpassed 500 on the 17th, 1,000 on March 20th, and 2,000 on the 23rd. It suggests new cases are now more than doubling every 4 days. And at that rate, we could see 10,000 cases or more by the end of March, which is just next Tuesday.
The doubling time initially will be 3 days or 4 days, and then it starts to get shorter and shorter as more and more cases happen. And that's what we were seeing in Italy. And our hope is that we can kind of keep that rate as low as we can.
The risk is to all of us of getting the disease and overwhelming our hospitals in this critical period.
But if we're not aggressively implementing social distancing measures, then that's going to be a problem. That is going to be a problem for every hospital in the country.
Francois Legault is blunt about the job in front of us all.
The faster we limit contagion, the faster we'll save lives.
Eric Sorensen, Global News, Toronto.
We know you have lots of questions about this virus. Our Jeff Semple will continue to consult with experts and try to answer them. Email your questions at globalnews.ca, and our website also has a special page dedicated entirely to COVID-19. You can visit globalnews.ca/coronavirus.